Located 1 kilometer away from Modaya town is the Mwai Kibaki Hospital. The newly commissioned hospital has in the past 3 years gone through a major transformation to elevate it to the standards of a level 6 hospital.
The strategic thinking is actually giving services that is affordable, availability, and sustainable, but of quality. We wanted Kenyans to feel that the government is feeding them. The government is coming to address their needs at home.
It's a journey which we have committed ourselves. We will walk. We know that it will not be. It's not smooth all the way. There will be challenges here and there. But the good thing is turning those challenges into opportunities.
When we were starting the hospital, we started with a bed occupancy of less than 10%. As we talk now, our occupancy has moved up to above 65%.
We were handed over the facility in 2019, November, to make it be able to operate as a level 6 hospital. So we've worked with it since then to date.
The hospital has a 350-bed capacity staffed with well-trained and specialized doctors. The various units at the hospital are a 70-bed medical and surgical ward, 35-bed maternity ward with a designated maternal theatre and HDU unit, a 16-cot fully kitted newborn unit with dedicated neonatal nurses manning the unit, a 30-bed pediatric ward, a 21-bed state-of-the-art critical care unit, 3 theatres, that is trauma theatre, main theatre and the maternal theatre, a 24-hour accident and emergency unit that has a dedicated pediatric emergency unit, a 24-hour renal hemodialysis unit with the only isolated bed in the region for HIV and hepatitis B patients, a diagnostic unit to cater for your lab and radiological tests, specialized clinics that run Monday to Saturday, managed by consultants and specialized nurses for those critical cases.
One of the things I would really say, which gives me motivation and drives me, is coming in and meeting with patients who are going home happy. That is what drives me.
We have quite a number of specialists who are running the clinics, both the doctors, the nurses and the support team. We have the urology clinic, we have the dermatology clinic, we have the obs and gynae clinic, general surgery, orthopaedic, we have ophthalmology, we have ENT, we have dental clinic, among others.
With the dawn of universal healthcare, Mwai Kibaki Hospital is rightfully poised to be in the lead of actualizing this vision.
First thing that we did so that we can be able to make this facility work, we had to come up with a strategic plan. We identified the key human resource that we needed and we started the recruitment to make sure that the facility is able to run to the full capacity, that is the 350 patient capacity, and the need arose that we need to expand the key support facilities.
Mwai Kibaki Hospital was commissioned by President Uhuru Kenyatta and was able to officiate the opening of one of the few recently completed projects, the mega oxygen plant that has the capability of generating 1,500 litres of oxygen per minute.
This is the only oxygen production unit of its kind that we have in the Mount Kenya region. The air is extracted from the environment and we are able to get pure oxygen at 93 to 96 percentages of pure oxygen. And also at the same time, the capacity being 1,500 litres a minute, so equivalent to 90,000 litres an hour, or 2,160,000 litres of oxygen in a day.
This is more than the hospital can consume, so the facility has recently opened up to selling to other healthcare facilities at subsidized rates.
It has the capacity, because if we are consuming 200,000 average in a day and has a capacity of 2,160,000, then that means you have an extra 1.8. That becomes an advantage to us so that we can help our patients and we can also help other hospitals out there that are struggling with oxygen therapy.
Other new completed and operationalized projects are a modern kitchen, a fully equipped laundry, a 200 body capacity farewell home, but currently operating at 20%, a capacity of 33 bodies to begin with.
This one we've been able to do it through that strategic plan that I mentioned, and we have cut it into the budgets. Every year we keep on looking and reviewing our budget so that we can be able to manage this.
Mwai Kibaki Hospital projections are high, and with a highly trained staff and dedicated management, it's scoring high in service delivery.
When we came in, there was no CCU. The structure was there, but it was not operational. The newborn unit was not operational, and we've been able to start a 16-bed capacity newborn unit. We've been able to increase the capacity of the CCU from 6 to 21. And also, we used to have a renal unit when we were starting, which used to run only once a week. But because of the demand, we've been able to increase, and we are running our renal unit to 24/7. And we've increased our numbers more than 200%.
Imetusaidia sana here and beyond, because me I come from the next district, but I find it is nearer here, it's better for us because I used to travel all the way to Aga Khan.
Imenisaidia juu wakati nilikuanga hapa kuleta bibi yangu asaidike na mtoto, wali ntiriti penye nijapenda mimi.
Ni mwana wakwa ndarehete agĩire na mutino wa nduthi, agĩikara ICU mweri mũgima, onjukaga ngakora ndaiguaga ndonaga hatirĩ na mwĩhoko, nĩndagĩte mwĩhoko thĩinĩ wa mwana ũcio. No Ngai no mũnene, nĩ tondũ nĩndakorire mwana akĩaria, ona ndagĩtarĩ cia gũkũ nĩciakenire na njĩra nene.
Mwai Kibaki Hospital knows the stress and pain of getting quality healthcare, and that's why it has diversified its offering by opening up a private wing.
We realized there's demand for private care, and especially for those members of the community, the senior civil servants and other insurance and corporate clients. So we've introduced a private wing where now we are admitting those patients, and we are looking at it like this private wing helps the hospital at least to generate some revenue which will support the main hospital.
Mwai Kibaki Hospital is a center of excellence in the provision of specialized healthcare, more so the management of non-communicable diseases, which have been a thorn in the flesh for the people in the central region of Kenya.
We decided we will start with addressing Kenyans' needs in this region. One of the needs was actually high blood pressure, blood sugars, and cancers. And we decided that was our starting point.
We've employed specialists to to take care of patients with diabetes issues. We've also specialized nurses who are able to work with the patients in their care. And now that even we have an ophthalmology unit, because we know diabetes also sometimes affects the issues of the eye, the team is able now to work together. We've established an oncology unit. On issues of hypertension, we have a team of specialists, doctor specialists who are taking care of that. So as we plan to expand and come up now with centers of excellence in terms of structures, we have the specialists to take care of that.
What we are seeing, our vision of offering specialist healthcare is coming to reality, and it is coming to the reality with the committed staff we have, with the support we are getting from the KNH management and the board of management. We are seeing that there is light at the end of the tunnel, and we will be able to provide quality, innovative, evidence-based specialist healthcare and also facilitate training.
One thing that we thrive for is we want Kenyans to have value for their money in terms of service delivery, in terms of service quality. That's what we thrive, and that's what we are dreaming for. The vision is that at some point every patient, every client, every Kenyan must have a smile because his health and wealth has been protected.
For any questions or queries, please contact us on the contacts on your screen. Mwai Kibaki Hospital. We listen, we care.